Are you okay? So I'm trying to basically get all the, keeping it broad, all the fibers of the okay? And she's good, but some people wouldn't be able to take this anymore because I'm going quite deep. You okay? Okay, with the gastrocs, you do need to activate them. So I'm going to use the sheet here. Can you just gently push against me? A little bit less, yeah. So now she's contracting the muscles up maximally. I'll do what I did before. I squeeze them and strip them. Using as much pressure as I can, because now when the muscle is contracting, you can usually afford more. I'm going. And stop.
Can you just tell me what you need to sit acting like that?
She was basically pushing her foot against my thigh, contracting the muscles, right? Now, can you just take your toes and wiggle them up and down like this? Yeah, keep on going. So she's just activating all the posterior. And I'm gonna strip from the Achilles tendon between the two heads of the gastrocs. Keep on wiggling.
Okay.
Ah, okay. Was that painful or ticklish? More painful?
That was painful.
If we don't want to go with the elbow, can we go fist, knuckle?
Of course. Yeah. I'm using the elbow because it is less stressful for my body than pretty much anything else, right? If you use your thumbs, your knuckles, your wrist, there is always compression force in the carpus. When I use this, that's just bone, right? That will never give up on me. Like I would actually recommend for like if you wanna stay, yeah. Like I would, yeah. I would recommend that if you. These days when I'm working, I use my forearms and elbows, even when I effleurage, right? Even when I effleurage, I tend to do this, right? Or when I do general massage techniques. I would recommend that you try practicing it when you work on clients. Take all those basic techniques like ringing, effleuraging, kneading, and try to do them with your forearms, because it feels klutzy at the beginning because you don't have the sensitivity like in your fingertips, but it will learn, you know, and this surface will learn too. Like, I remember when I started first experimenting with, I used to work in a, I was in London at a place called Gold's Gym, right, and it was like a bodybuilder's gym. And I had an office there, and many of the bodybuilders, they wanted to work on me with deep pressure. And at that time, I wasn't really aware about these activation techniques. For me, deep pressure was basically just crush it with your hands, right? And I started doing it with my fingers, and I was strong. You know, I was strong, but still my fingers were like cracking, and so I was forced to start using my elbows. And at the beginning, I just couldn't feel anything, right? You know, but after 5-6 years, you know, I can, yeah, after 5 or 6 years of trying and trying, you know, I can see trigger point there and my elbow feels it, right? Because yeah. Your skin anywhere in the body can expand and grow sensory receptors if you train it. That's why people who, let's say, cannot use their hands, they can train their feet to do sewing and writing, because with practice you develop more sensory receptors. Same with massage. There are massage therapists like in shiatsu or lomi lomi or Thai massage who do the entire massage with their feet, right? Because, you know, if I tried it, it just wouldn't happen. But if you train your feet or your elbow, eventually you develop tactile sensitivity equal to your fingertips. Yeah. Like I read some interview with a magician, right? And he was saying how for about 2 or 3 years he was training himself to do a trick where you put pennies in a bag and he can reach for any penny and tell you what year it was printed. And you know, like, and he was saying that at the beginning he couldn't feel it, but he was consciously trying to feel the year on pennies, and after 2 years he was able to feel the year, right? How did I get here? Yeah, so I would recommend that even, but in the long run, if you start using this, it's better for your hands and longevity than using. It's easier to use your thumb, really. You know, like if I do this, right? It's, you know, if you do it 8 hours a day, thumb is gone. Okay. Can you take your toes again and wiggle them? Yeah. So this is one of the very few times that I would use my thumbs. I wanna strip. See, once you use your fingertips, it may hurt more because it's more fingertipping. So this is where the activation. Keep on going. Are you okay? Yes, yes. Which basically takes the edge of the ticklishness, at least. Okay, keep on wiggling your toes. Are you okay? So when using my thumb, I pull, right? It's safer than pushing. And stop. And then stretch. If you can take your toes and hold them up there like this, okay? So passive stretch release. Kneading, basically. Short kneading strokes while she's stretching the plantar fascia by extending the toes. Move it up again. And let go. Extend one more time. Okay, hold it there.
It's okay.
So where did the head come from? Are you okay? So I'm going as deep as I can. Right, like toe up, yeah. Like I'm working hard. Let go. One more stretch. So that's it. With the plantar fascia, we can either activate it by pre-stretching, we can wiggle the toes, or we can ask the client to push against you and work on the Achilles tendon. Right? There is not much of a variety.
Stretching.
Yeah, wiggling the toes.
First and next.
And I also did this, where she was pushing against me for the gastrocs and I was stripping the gastrocs. Right? I also had the toe pointed. She pointed the toe up and I was stripping down this way. And when you have it done for 15 minutes, you feel like you can walk on clouds.
I have a question.
Yeah?
How it's look like in the photo? reflexology it's
Yeah.
a bit different work and different approach. So does it interfere with the reflexology
Yeah.
or not?
You know what? I don't know enough about reflexology.
Okay.
Yeah, I wish I